Hi, my name is Svetlana. I'm a registered nurse, and today we're going to be talking to you about your heart health. We're going to go over risk factors for developing heart disease, different screening options we have for you, and things that you can be doing at home to keep your heart healthy. There will be a short 5-question quiz at the end of our discussion to kind of test your knowledge, but it's nothing to be nervous about. We're going to go over it together. So let's talk about risk factors first. There are different kinds of risk factors, ones that you have no control over and ones that you do have control over. So non-modifiable risk factors, things you can't control, are family history of cardiac disease, your gender. If you're a male, your risk for developing heart disease is going to be higher, and if you're over the age of 45. So those are factors you do not have any control over. However, there are factors that you can control and that you can manage. This includes your cholesterol, your blood sugar, your weight, your diet and exercise, blood pressure, stress, and whether you smoke or not. So all of those risk factors can be managed with things that you can do at home. And we're going to talk a little bit more in depth about those. So first of all, smoking. Absolutely have to quit smoking for your heart health. Smoking is not something that just affects your lungs, it affects every blood vessel in your body. So quitting smoking is really one of the best things that you can do. The second, probably biggest and best thing, is following a heart healthy diet and exercising. Doing those two things is going to manage almost all of those risk factors that we just talked about. So a diet and exercise can help manage your cholesterol, your blood sugar, your weight, your blood pressure, and even your amount of stress. So when it comes to a heart healthy diet, we recommend lean proteins like chicken, fish, vegetables, fruits, whole grains, and I am going to send you home with a little guide from the American Heart Association with things that are good to eat and things that you should avoid. So everything we just talked about's up here: healthy oils, healthy fats, things to avoid, processed foods, sugar, unhealthy fats, things like that are listed here. So this is just a nice little guide that you can take home with you, maybe keep on your fridge or take to the grocery store with you. So you'll be able to take this home with you. As far as exercise doesn't have to be overly strenuous. Walking is amazing for your health. So walking at least 30 minutes a day to get yourself some exercise, and also help with your level of stress, can keep your stress down if you're moving your body, if you're outside in nature. Doing these two things alone is going to manage those risk factors we talked about, and it's going to lower your risk for developing heart disease. So let's talk about a few screening options we have to check and see if you are at risk for heart disease. One thing that we can do is we can order some blood work to get your blood sugar and your cholesterol levels checked, and we can order those things for you today. The third screening option that we recommend is monitoring your blood pressure. So we can do that today, and then you can also do that at home. I'm going to provide you with a little blood pressure machine that you can keep at home. It runs on a battery. It's very easy to use. And this way you can monitor your pressure, and you can keep a journal of your pressure at home. So write it down in a journal, keep track of it, and then next time we see you, you can bring the journal with you and we can talk about what those numbers mean. I will also give you this little handout here, and it goes over the screening options: getting your blood sugar checked, getting your cholesterol level checked, and then this chart right here from the American Heart Association is actually going to show you what those blood pressure numbers mean, whether or not they're good, a little high, or too high. So this is a nice guide to keep with you when you're checking your blood pressure. I want to go over some signs and symptoms of very high blood pressure. So headache, blurred vision, dizziness, chest pain, all of those things can indicate your blood pressure is high. You need to check it and then call your doctor if your pressure is high. If diet and exercise and those other changes that we talked about aren't working to control your pressure, we might need to talk about getting a medication that can help to manage it. So I am going to give you the machine for you to keep track at home with a journal. You're going to go home with a little Heart Healthy diet guide and the little chart for your blood pressure and the other screenings that we discussed that you can get done. And that's all I have for you today. If you have time, we have a quick little 5-question quiz about what we discussed. And I'm here to answer any questions, and we can chat about what our next steps are, and if you would like to learn a little bit more about your heart health, I'm here. Thank you.